Hi everyone, Leanne here. Just wanted to kind of make a quick video about how I've been feeling the last few days. It's been a bit of a struggle, been really tired, just focused on healing and getting a lot of rest. And coming at you from my bed again. Yeah, so I heard from the cancer center and I've made an appointment for my consultation, which will be in a month. And I was kind of like dreading having that appointment on the books because I really felt like normal was creeping back in, or at least the new normal was creeping back in, and I was feeling like I needed a little bit of a break, and that sort of time period between my last procedure and surgical follow-ups, the time period between those and my consultation with the cancer center would be indicative of how normal my situation is and how I could just kind of take a breather, and maybe the longer I didn't hear from them, the longer I could put out of my mind the idea that I might need some additional treatment based on the findings. So just to recap, in November of 2021, I was diagnosed with ductal carcinoma in situ, which is also known as DCIS. It's a form of early stage non-invasive breast cancer, and it was 1 centimeter on mammogram and ultrasound. And there were areas of microinvasion that were found at that time. Now, when you do biopsy, it's just a sample. So I knew that it might be like an iceberg where you just see the tip of it and then later on realize the actual depth and breadth of the full situation. So fast forward now to my actual surgery, the big surgery, the bilateral mastectomy, the double mastectomy, the breast amputation, the breast removal, whatever you want to call it. I did that January 24th, 2022, and the pathology came back that the DCIS tumor had actually grown to 4.8 centimeters in that very short period of time. And we knew at the time of biopsy that it was high grade, and it was also the type of cell that was showing a really quick die-off rate. I don't know what that even means, but it was chematotype or nuclear type 3. So just showing that the center of each cancer cell had like a bit of necrosis already. So it was like a very aggressive type and very likely to turn into invasive ductal carcinoma, which it did. So on pathology, my DCIS was 4.8 centimeters, and there was a diagnosis of invasive ductal carcinoma right along with that. So I have 2 types of breast cancer in my left breast. So the invasive ductal carcinoma portion of it is 0.5 centimeter, which is amazing. It's really, is it 1 centimeter or is it 0.5 centimeter? I think it's 0.5 centimeter. So I'm actually really happy about that, but and it hadn't spread to the tissue surrounding it, like the skin, the muscle, the skeletal area, from what they could see. But it had not spread to the sentinel lymph nodes, of which they took 3, and all 3 were 0, or negative rather. And so what that means is that I'm node negative, but LVI was present, and LVI means lymph vascular invasion. So it hadn't made its way to my lymph node, but it made its way to the driveway of the lymph node. And it's just a funny way to describe it, I guess. In my head, there's like a bit of a story going along with this when I kind of say it out loud. But what that just means is that there's no way to tell if it was indeed going to go to the lymph node or if it actually just decided to take the route of the vessel, the lymph vessel or the blood vessel that's attached to the lymph node. There's no way to know, did it take the plane, the train, or the automobile? So if the lymph vascular system is the driveway to the lymph node, maybe it's also a runway for the plane just to take off, right? We just don't know. And I don't think any doctor out there would tell you that they know, because they don't. So this is fast forwarding to now, where I'm about to go for a consultation with the cancer center, where I'll meet with a medical oncologist, and I'm told that they've paired me up with somebody who's a hematologist and a breast cancer expert. So they'll be well versed on my history of Hodgkin's lymphoma, as well as my current situation in dealing with breast cancer. So I'm happy to know that I'm being paired with another expert in their field who it should be a good pairing, a good match for me. Now, whatever they recommend, they might recommend no treatment that's required further, maybe because I'm estrogen and progesterone receptive positive, or ER or PR positive, as you may have heard or read about in the past. HER2 negative, so that's a good thing. Just a little bit about ER/PR positivity. It's often indicative that the cancer began in the breast, because your breasts are associated with female hormones. And so when your breast cancer cells are shown to be ER/PR positive, it's almost a good indicator that the cancer began in your breast and that it didn't travel there from another location. So that's good news. Also, it means that there are receptors on each cancer cell that attract your estrogen and your progesterone. And when your body produces those hormones naturally, they just travel to those cancer cells, latch on like a lunar lander, latch on, and then can sort of make the cancer cell a little bit like beefier, more aggressive. So there's certain specific targeted treatments that can bind to the estrogen in your body before it actually gets a chance to make its way to the cancer cell and bind to it. So you may have heard hormone therapy discussed as a part of your treatment protocol, and that's something that I think will be offered to me. And quite often it's like an aromatase inhibitor, something like tamoxifen. And I have been vocal to my family and on this channel about whether or not I would actually be willing to go ahead with tamoxifen. And I'll just speak a little bit about that really quickly here. My initial gut instinct was no. I was diagnosed with DCIS and told that my best chances to avoid recurrence of breast cancer and to eliminate breast cancer from my body right now was to have a very aggressive surgery to remove both breasts, both my healthy breast as well as the diseased breast. Not just the diseased tissue within my breast, but the entirety of the tissue in my breast. So I went ahead with that surgery under the notion that it would give me sort of a sense of confidence going forward. And also it would put me into like a 1 percentile risk category. So the chance of recurrence of the breast cancer, while it's still there, it's reduced drastically to like around 1%. And so the thought of having to do systemic treatment like hormone therapy for 5 years, with all of the side effects that come along with a drug like tamoxifen, it's kind of off-putting because of how aggressive I went with the surgery. So get a better view here. So basically, I'm a little bit hesitant to do tamoxifen, but I'm softening a little bit on my stance with respect to treatment going forward because of the pathology from my big surgery. As you well know, if you've watched my other videos, you also know that I did have to have a revision because my margins were not clean. So I actually still had a bit of cancer in the surgical margins of my left breast. So they had to go back in at my 1 week post-op appointment, and under local anesthetic, they removed an 8 centimeter by 4 centimeter piece of skin and tissue that went along with it. Anyways, so just to make a long story short here, because I'm not going to keep you guys on here forever, I also believe that because of the LVI, the lymph vascular invasion being present, I also believe that there's a chance they may offer me chemotherapy. And I'm on the fence about that. So there's a test called an OncoType DX type, or an OncoDx type test. And, oh, my dog's joining us here. Hi, Jasper. Okay, that's enough. You lay down. Good boy. So, this is a test that has to be ordered by the medical oncologist, and it is something that insurance will cover, and it will help me decide whether or not chemo's right for me, because it will actually give me a score based on my pathology, and they do a genomic sequencing of the cancer cells that were found, and based on the results of the genomic testing, it will actually indicate whether or not I have a likelihood of my disease, the course of my disease actually being helped by taking chemotherapy. And they do this for DCIS, and they do it for early stage invasive cancer as well, with node negative ER/PR positive status. So I just think that this is something that I'm going to want, although I have heard of people in the UK having had this test and having the results come back right in the middle, where it actually didn't really indicate strongly if they should or shouldn't. It was just sort of like right in the middle. And then there have been cases that I've read about where people were advised by their medical oncologist that chemo wasn't really needed, and then the OncoDx type test came back saying that yes, they would recommend chemo. And then also the other way around as well, where the doctor recommended whatever it was that I gave you the first time. I think it was that the doctor recommended the chemo, and then the test didn't think the chemo would be beneficial. So there's both scenario, all three scenarios that are playing in my mind right now that I'm just not sure about at this point. So I'm kind of like, I've had a couple of rough days emotionally, mentally, and you can hear my dog chewing his bone here. Thanks, Jasper. We love you. Yeah, so I'm just really grateful that I have a wonderful, supportive husband and son who have allowed me to sort of be in bed and rest and get my mental game back on point these last couple of weeks, and specifically these last couple of days. So I'm going to jump off now, but I want to know your thoughts. Are you going through chemo? Have you gone through chemo? Did you get an OncoDx test? I'm really curious to hear from people who have had this, and did it help you make your decision? Were you on the fence about chemotherapy? Did you go for it? Did you turn it down? Was it the right decision for you? Let me know. I really need to hear from you if you are in the same situation. It would really, really help. Put your comments and questions below. Subscribe to my channel, No Cure for Happy. Hit that bell. You'll know when a new video comes out. Hit that like button. Helps me be a part of the Facebook. Not on Facebook, sorry. It helps me be a part of the YouTube algorithm so that my videos can be recommended and get into the hands of the people who need it the most. And so thanks again for tuning in. I really appreciate your time and your efforts here. And welcome to the community. If you're fighting this breast cancer battle, you're not alone. There's others like you. You just have to find us. And I hope you do. So, as usual, thanks again. And I'll see you in the next video. Bye.